I'm Allison Arwady, the Commissioner at the Chicago Department of Public Health. We'll be giving an update today on COVID-19 numbers in Chicago, an update to the travel order, and then talking some about vaccine planning here in Chicago. I have with me Dr. Candace Robinson. She's one of our medical directors at the Chicago Department of Public Health. She's a pediatrician. She has 5 years of experience at the CDC in the immunization program, and then joined us here at the Chicago Department of Public Health this summer. She is leading on the medical side of vaccine preparedness here in Chicago. All right, let's go ahead and get into our travel order. So as of today, Chicago's travel order includes 46 states and Puerto Rico with the new tiered risk level. Just as a reminder, the states that are in red are states where you should avoid travel. It is required in the states that are red that upon arrival in Chicago, you have a 14-day quarantine. The states that are in orange, which at this point is almost the whole country, also the advisory is to avoid travel, but for these states, you can either do a 14-day quarantine or you can get a negative test result within 72 hours before coming to Chicago. And then while you're here in those 14 days, strict masking, social distancing, and avoiding in-person gatherings. And then our yellow states, if we go back just to look at the map again, you'll see there are only 3 states at this point in the country that have a COVID-19 level fewer than 15 cases per day per 100,000. That's been the level where the quarantine has been required all along. Maine, Vermont, and Hawaii. Those are the only 3 states in the US still there. And so for those 3 states, we still recommend avoiding travel that is not essential, but there is not a requirement for a quarantine order or pre-arrival testing if you're coming from one of those states. As a reminder, the states that are in red are the states that have a higher case per population level than Chicago. So at this point, these are places that have more than 85 daily cases per 100,000. That's where the quarantine is required. The places in orange have a level between 15 cases per 100,000 and that 85 mark where Chicago is now. But the bottom line, you should not be traveling. Right now, COVID is surging across the entire United States. And you run the risk of bringing COVID with you if you're traveling from Chicago and from really almost across the country. People who are traveling are coming from places where COVID is surging. So if you've not canceled your Thanksgiving travel plans, now is a good time to be having that really difficult conversation with friends and family. So let's look at where our COVID numbers are now in Chicago. So as of today, we have had 135,149 people diagnosed with COVID-19 in Chicago. If we break that down, more than 25,000 of these people, almost 1 in 5 of the people who have ever had COVID in Chicago have COVID right now. That lets you know how much this is surging. You can see about 79% of the people who have had COVID in Chicago have recovered, and between 2 and 3% of the people who have been diagnosed with COVID in Chicago have died. But if we come back to this number, where there are 25,000 people right now who are tested and infectious with COVID, we know that about 5 to 7 times as many people as have been tested actually have COVID-19. And we know that based on our death numbers, based on some of the serology testing that's been done, and based on estimates across the country, which say across the country between 5 and 10 times as many people likely have COVID as have been diagnosed. When you take that estimate, that means that right now, between 125,000 and 180,000 Chicagoans have active infectious COVID right now, which means as many as 1 in 15 Chicagoans has active COVID-19 right now. And that is why the risk of gathering is significant. It's why we've recommended that you not have anybody over into your home right now that doesn't need to be there. If it's essential, like a home health aide, a person coming in to do essential childcare or education, they can come in, but it's really important that everybody's being careful with masking and distancing. And if this is a visit that can be delayed, it must be delayed at this point. The risk is just too high, and we know that particularly in homes, people tend to put down their guard, and we see COVID spread. Also, if we look at our epi curve here, you'll see that Chicago cases are still growing without signs of slowing. Our doubling time remains at 12 days. As a reminder, this is going back to early October when this second surge started. We are at a point where our number of new cases every 12 days are doubling. We're at 2,296, almost 3,000 new cases being diagnosed every day in Chicago. That means 12 days from now, by the time we're in Thanksgiving, we could be talking more than 4,000 cases per day. And that curve has not yet shown any signs of flattening, which is why we've needed to put the stay-home advisories in place, which is why we've needed to put additional restrictions in place, and it's why additional restrictions may be coming. I ask you, please, take this seriously. Do the things that you know work. Wearing a face covering whenever you're leaving your home, washing your hands, keeping that 6-foot distance, protecting people who are at higher risk for severe outcomes, not having anybody over to your home, and right now, staying home as much as you can. If you need to go out for work, for school, for essentials like medical care or groceries, obviously you can do that. But otherwise, we need to take chances away from COVID-19. It is spreading right now every chance it gets in Chicago. Our test positivity also continues to increase without signs of slowing. On this graph here, the gray represents our number of tests per day, and we are breaking records there. We're testing almost 16,000 Chicagoans on average every day. That's twice what we were doing if we look back just a couple of months ago. However, despite that increase in testing, our positivity rate has more than tripled since early October. We are now at a 16% positivity rate here in Chicago, where we were just at 5% early October. Go ahead. Also, these cases have continued to dramatically increase across all race ethnicity groups. They've continued to increase across all zip codes, and they've continued to increase across all age groups. I still hear people saying to me, this is a problem among young people. No. We are seeing high case rates among people in their 20s, in their 30s, in their 40s. Those are our highest rates. But if you look at this graph, and you can go to chi.gov/COVID- if you want to explore this yourself, every age group has seen these significant increases, including Chicagoans over 60, over 70, and over 80. And that is why hospitalizations and deaths are also significantly increasing. We have more than 3 times as many people hospitalized, but not in the ICU in Chicago with COVID-19 as we did in early October. You can see at our low point, we had 249 people in Chicago hospitals who were diagnosed with COVID or likely COVID and waiting for a test. As of now, our average is at 910 people in Chicago hospitals with COVID, not in the ICU, and our most recent number was 977 people hospitalized. If we look at the ICU, back in early October, we had 77 people in Chicago ICUs. Today, we're averaging 256 people with COVID in Chicago ICUs, and our most recent number was 280. And then finally, people on ventilators. We have more than 4 times as many people with COVID-19 on ventilators in Chicago hospitals as we did in early October. We had just 33 people seriously ill on ventilators a month ago. And now we're averaging 140 people with our most recent number of 153. And unfortunately, deaths too continue to surge. We're seeing 7 to 8 deaths per day. We had 56 Chicagoans die from COVID last week. That's up from 2 to 3 Chicagoans dying a day throughout the summer. And unfortunately, we've not seen signs of any of this heading the right way yet. And so in that context, of course, we've launched Protect Chicago. As you heard last week, you can go to chi.gov/protect if you would like to be part of our initiative to making sure that all Chicagoans have the information they need to help protect themselves, their families, and Chicago from COVID. We're developing information to help you create a COVID family plan, with an expectation that it is likely someone in your family may be diagnosed with COVID. We want you thinking ahead about testing, about isolation and quarantine, about who you're calling, who your healthcare provider is. We'll be getting more information out to make sure people are understanding the current recommendations and restrictions, because those do continue to shift. But the bottom line is we need people limiting their activities as much as they can. And then finally, not just for traveling, if you haven't covered your Thanksgiving plans yet with your friends and family, please do cancel your traditional Thanksgiving plans. I normally would be traveling to Michigan, seeing my extended friends and family. I love Thanksgiving. This year, I'll be staying home. I'll be having that celebration over FaceTime or Zoom. It's not what I want to do, but it is the right thing to do for myself, for my family, and for Chicago. Please make that same decision. For the last part of this conference, we wanted to shift to some good news about vaccine progress. So I know some of you have seen in the news that there have been a couple of announcements related to ongoing COVID-19 vaccine trials. Just recently, the first COVID-19 vaccine trial that is in phase 3, meaning the large-scale trials in the United States, announced some preliminary results, interim results, that the vaccine was more than 90% effective with a good safety profile. Similarly, just this week, the second vaccine that is in large phase 3 trials in the US from Moderna also announced a vaccine efficacy of over 90%. Let's talk just for a minute about what that means, because I know people have questions. There are many vaccines that are in trials, meaning they've been developed in the laboratory, they're checked first on animals, and then they move through a series of successively larger trials in humans to make sure, first, they're safe, second, that they mount the appropriate immune response, and then thirdly, that they actually perform like we would expect them to perform in the real world. Those phase 3 trials are the trials that involve tens of thousands of volunteers. And the way they work at the most basic level is that half of the people, the volunteers in the trial, receive the vaccine that is under study, and the other half receive a placebo, meaning they get a shot, but there's no vaccine in that shot. The participant does not know whether or not they received the real vaccine, and the doctor giving the shot does not know whether they received the true vaccine. Those tens of thousands of people then go about living their lives, and we wait to see who gets COVID. And once a certain number of people have gotten COVID in this trial, we're able to get these interim analyses, because still the participants and the doctors don't know who's gotten COVID, but behind the scenes, there's a group of scientists that monitor the safety and monitor the efficacy, and they open it up and they say, okay, we've had, for example, 94 people get COVID in this trial. And they look and they say, wow, out of those 94 people, 90 of those people were in the placebo arm, meaning they did not get the real vaccine. And only 4 of the people that got COVID were in the vaccine arm, meaning they got the real vaccine. And importantly, at least in the Moderna information, the people who did get COVID in the arm of the trial where they got the vaccine did not get seriously ill. All of the seriously ill people with COVID were in the placebo arm. And so this lets us know in the preliminary assessment, this vaccine was more than 90% protective against COVID, and the safety profile looks good. But these trials are not done yet. They go until a predetermined endpoint when a certain number of people have gotten COVID and there's been enough time to collect the safety data that is required. One of the only good things about the way COVID is surging in the United States, in Europe, and around the world is it's actually made these vaccine trials go a little bit faster only because more people are getting infected with COVID. And in that context, we are anticipating both of these companies to likely finish their trials just in the next few weeks and be submitting what's called an emergency use authorization request to the FDA, and it will then be under review. If the final data from these trials, or the next data from these trials, continues to look as good as this interim data looks, and if the safety data looks good, most importantly, I think it is likely that we may see the first emergency use authorization FDA approval for a COVID vaccine in the next few weeks. And if that happens, I think it's likely we could have our first COVID-19 vaccine here in Chicago before the end of the year. We don't know that for a fact. We will only know that when the vaccine trials are appropriately completed, when the FDA has completed its review, and then the CDC also looks at the data, and there's an external group of scientists that make recommendations about who should receive this vaccine, and there's some more detail there. But we are planning here in Chicago. We've been ready, and we are ready to start COVID-19 vaccine administration when the trials are done and when we're sure that the safety and efficacy data looks good. However, the initial supply will be limited. There's been a decision to distribute this vaccine across the United States. And so we'll be receiving tens of thousands of doses likely. Those will start with healthcare workers. And I'm going to bring up Dr. Robinson, who knows all of the details about all of the work that we've been doing here in Chicago for vaccine preparedness that goes all the way back to February, when most of the country was frantically scrambling to buy personal protective equipment. We had to buy some PPE, but we had stockpiles of millions of masks and gloves and other information because we had purchased that ahead. We spent time back in the spring buying up the supplies that we would need to be ready for an immunization campaign. We've also been doing much more in the logistics, much more in the planning, and working closely with the many, many partners that will be part of this. So I'm happy to be able to share this vaccine news, but as a reminder, it will be months before this vaccine is widely available. It's not going to be available for the general Chicagoan, certainly this year, likely not in the first quarter, which means right now, the things that we have to control COVID are the things that we've had all along, and that remains in your hands. I'll bring up Dr. Robinson.
Good afternoon. I want to talk a little bit more about the vaccine prioritization that Dr. Arwady mentioned. As she mentioned, initial supplies of the vaccine will be limited, and thus we have to prioritize who will receive the vaccine first. Now, healthcare workers will be the first population recommended to receive the vaccine. And specifically, healthcare workers who work in the hospitals, taking care of COVID-19 patients, and doing procedures that put them at higher risk will be prioritized first amongst healthcare providers. Now, there are other considerations. There are other groups that will be early groups vaccinated, such as first responders. And we're also probably also vaccinating long-term care facility residents after the vaccination of healthcare workers and first responders. And that's just based on the recognition that the virus has spread easily in long-term care settings, and that those residents are typically at higher risk for severe disease, just given age or other conditions. Now, all of our prioritization planning is based on the framework currently that was released by the National Academies of Sciences, and we'll also be updating our framework to include recommendations by the CDC as they come out as well. Next slide. Also, I wanted to talk a little bit about what the Chicago Department of Public Health has been doing to prepare and plan for COVID-19 vaccine. So our current focus is coordinating with partners and specifically hospitals to prepare for the first phase of vaccination and vaccination of the healthcare workers. So we are working with our hospitals. We are enrolling them to be vaccine providers. We are getting additional information from them on their healthcare worker numbers and who may fit into those higher risk categories, et cetera. But we've also been doing a lot of preparedness work, as Dr. Arwady mentioned, in advance of this. So as she mentioned, we have been acquiring supplies needed for vaccine administration. We have expanded our capacity for vaccine storage at multiple different temperature levels. One of the early vaccines requires a very low temperature for storage, and so we have freezers that can maintain that temperature. We've also been doing a lot of logistical planning. So we have been planning for all the logistics associated with the storage and handling of these vaccines. We anticipate that over time there will be multiple vaccines on the market. We are planning for that. And in addition, we are also planning our clinics when we do start to run the Chicago-based clinics. We actually used our flu clinics as an opportunity to practice for our COVID-19 vaccine administration and really institute a lot of new practices in our clinics to allow for social distancing, allow for pre-registration and expanded hours, et cetera, so that we can social distance people and have people arrive at different times. So we continue to get more information, and as we receive more information and as we move along in the planning and through the different groups prioritized for vaccination, we will of course have additional information. And I will turn it back over to Dr. Arwady at this time.
Thank you, Dr. Robinson. Happy to take questions.
Good afternoon, Dr. Arwady. I'm Michelle Gallardo with ABC7. I'm the pool for today. My first question from you is from one of my colleagues at Crane, and it does have to do with the vaccine, which is, and you may have mentioned it briefly in terms of, does the city have a sense how many vaccine doses it will get in the initial release, and what is the city planning in terms of maybe an educational campaign for residents who might be apprehensive about getting that vaccine initially?
Sure, I can start, and then if you want to chime in afterwards. So we do not know yet how many doses we will be receiving. We have built up and sort of have an expectation where we look at what some of the distribution has been. As I said, that this would be in the tens of thousands range that we would likely be anticipating. We've been thinking for some of our planning, if perhaps, across the first two vaccines, maybe we received enough to vaccinate, say, 150,000 people, for example, what would that look like related to our healthcare workers? We have more than 150,000 healthcare workers in Chicago. And so being able to start from a place of getting specific. I think one of the most challenging things when it comes to really vaccine administration is taking this down from the very high level to not millions and not thousands, but really thinking about the number of doses that come in a package. How do we divide that up? How do we send that out? So we're making some assumptions around that. We have, for example, for the ultra cold vaccine, we do have the capacity here here in Chicago to handle 135,000 doses of that ultra cold vaccine, which is a lot and more than we would anticipate receiving in an initial dose. But there are other hospitals that do have some other capacity for that ultra cold storage. But importantly, we will be distributing to places that do not have that capacity. We're really focused on making sure the vaccine will get where it is most needed. And related to the outreach campaign, I think I'll let you speak a little bit more to the details, but we want to make sure that when we are talking vaccine specifics, it is based on trials that are complete, and that we absolutely have the clear scientific information about how the safety and the efficacy of this vaccine has been proven. And so we're not quite ready to get into the specifics of the vaccine. A number of these, the early vaccines, for example, all have 2 doses. Some of them have different timing. There's lots of details within there. But at a high level, we have very much already started conversations with partners. And some of the work of Protect Chicago is laying some groundwork for that ground game to also be able to get additional vaccine information out to the public when it's available. And I'll let you chime in on either of those parts.
Yes, so yes, Dr. Arwady mentioned we don't exactly know how many doses that we are receiving, but she is correct. We've been planning just based on multiple different scenarios, and what if we got 50,000 doses, what if we got 100,000 doses, et cetera, so that we can be ready and able to distribute whichever amount we receive.
Just to interrupt you a little bit on that, because you mentioned, for example, that the city has the ability to store 135,000 doses of the ultra-cold vaccine, the Pfizer one. By that, we actually, since you require 2 doses to immunize someone, that would really mean 65, right? Enough doses for 65,000 people.
Right. So technically, the federal government is planning to only allocate a half at a time. Essentially, we would only receive the first dose all at once, and then later they would give us the amount for the second doses. So we wouldn't have to store that here. They are planning to distribute that accordingly to make sure that we have that.
Okay.
With regard to communications, we are working with our partner organizations. We've also started working to look at messaging. This will be a coordinated communications effort. We will have, messaging, from CDC and from the manufacturers and from the federal level with regard to the vaccine itself. And we will be working with community messengers as well for vaccine messaging. So this will be a coordinated effort to get messaging out about vaccine and to hear the concerns of the community when it comes to vaccines so that we can address them.
Thank you. And Dr. Arwady, if I may go back to asking you about testing. I have a question here from Manny Ramos at the Chicago Sun-Times. And Manny asks, lines at drive-through testing facilities in hotspot zip codes and elsewhere in the city are growing by the day. Yesterday, the line at Belmont Cragen's Hanson Park stretched over 1.5 miles with people waiting nearly 2 hours to get tested. Some say that they were turned away. Is there a plan to increase the number of drive-through testing centers in the city to help alleviate the pressure, especially in these hotspot zip codes?
Yes, and not just that, but on a number of fronts, we are working to quickly expand testing capacity. This, as you can imagine, is a problem not just in Chicago, but really across the country at this point. We will be sharing very shortly some additional details related to not just some expansion, but also some winterization related to some of those drive-through testing sites. There's been a lot of work happening in that space. But we also have been meeting with a lot of our clinical partners. So whether that's our federally qualified health centers, our hospitals, our private providers, we really want to be increasing their capacity to be doing testing and having that be well coordinated so people are able to find tests. The state also has some drive-through testing capability here, and we've been talking to them. And we'll be sharing some additional information related both to new tests that are now available and FDA approved that you can take from home. They're mail-in type tests, and more information will be coming there, but we are exploring every single avenue here in terms of improving access to testing and trying to be creative about it so that we're not overburdening the same networks that other parts of the country perhaps will be. We've been talking with hospitals about ways to pull this in, and we've received some additional rapid tests through the federal government, which are the rapid antigen tests. And so those have been distributed to federally qualified health centers and others. We're starting to also use some of those in some of our higher risk populations. And we'll have some more details on this to share very shortly. But suffice it to say, we know the lines are long. I encourage people to pre-register wherever they can. And you can look online. The best place to check first and foremost always is with your own doctor, because if you could get a test through your doctor, that's where we'd most like you to get a test anyway, because then you're connected into the medical care, et cetera, if it does turn out to be positive. So we're breaking records every day for the number of tests we're doing here in Chicago. I expect that number to continue to increase.
Now, when you say that you'll have more information very shortly, are we talking about a matter of days,
Yes.
next week, days? Okay. This question is related as well, and it's from Kelly Bauer at the Block Club, and it's about why the city's testing sites keep running out of COVID-19 appointments and tests, and how are you working to increase the supply of tests?
Yeah, so again, the city's testing sites are a small portion of the testing that is done in the city. And we have also been breaking records at the city testing sites. But part of this comes down to the logistics of how many cars you can move through a drive-through area in one day, or how many people can even walk up in one day. Some of what we're going to be sharing related to winterization and moving to some other approaches is in line with our goal to decentralize that a little bit more and make it so that perhaps more people are able to move through spaces. But we feel especially that we would like to continue to expand testing access. I'm going to be honest with you, we've not received additional federal funding to be able to do that. And we are continuing to use the initial federal grants that we received and have put millions and millions and millions of dollars into the city's testing program. I am very hopeful that now that we are through the election, there will be some federal action to make sure that there is additional funding received, not just for testing, but for COVID-19 planning, distribution, and messaging. At this point, we've received very little in that regard, and I do anticipate more of that to come. I think some of where we've been looking to the private sector and some of these stay-at-home tests are also recognizing that where people have other options, we'd like to encourage them to use those as well.
Okay. I have a question here from Fox. How closely are you and the mayor's office working with large institutions like the Shed, which already announced that they will close through the holidays today, Field Museum, et cetera, on whether they should remain open moving forward, and what advice are you giving them?
Yes. So I think these large institutions, right, we're under a stay-at-home advisory right now where we're really recommending that people not be out of their homes for things that are not essential. And that obviously makes it difficult for some of these institutions that we most love as Chicagoans. So we have, through the mayor's office, there's a number of groups working with a lot of the different industries. As you can imagine, there are major conversations and have been throughout this whole year. And I think, really appreciate that partnership through the Business Affairs and Consumer Protection, through DCASE, the special events folks, through the mayor's office, through many others, to try to make sure that our partners, and they have been really closely involved in these conversations and remain so.
Would you ask the other museums to follow the Shed's example and to close down during the holiday season?
I think we're going to continue to see shifting sort of requirements and guidelines here. I also think that from a business model where we're recommending that people are staying home, I would expect their numbers to be dropping significantly regardless. But I think this, unfortunately, is going to be, especially in the short term here, a time where it is going to be difficult for some of those larger institutions to stay open.
If I may now move to just a couple of questions for myself. The number that you gave at the top, 1 in 15 Chicagoans, that's pretty shocking to hear. Could you explain to us just once again how it is that you came to that number?
Yeah, I'd be happy to. Can you just bring the slide up, Janelle? Thanks. So the way that we calculate this is we look at how many people have positive tests right now here in Chicago. And we look at their likely infectious period, meaning the time where they're potentially spreading COVID. Somebody who has a very mild infection from COVID, we think of them as being infectious for 10 days. But then the last 3 days of that, they have to be without symptoms. We know there are people that are longer than that. And so we've made an estimate that basically people are infectious for this estimate for an average of 14 days, assuming that they are not hospitalized, and for 30 days if they are hospitalized. So our active cases include people within 14 days of having a test if they are not hospitalized, and within 30 days if they are hospitalized. So that's how we get to our 26,000 people who have COVID right now. And again, I mean, for me, I know there's a lot of numbers on the chart, but 19% of the people who have had COVID at any point have it right now, is a pretty striking number. And then we know that there are many people here in Chicago and across the country who do not ever get tested or diagnosed for COVID. The national estimates on this are that this is between 5 and 10 times as many people have COVID as are diagnosed. We think our estimates here are in the 5 to 7 times as many cases as are tested and diagnosed. And that's based on our mortality data, it's based on some serology data, and it's based on the fact we've had pretty good testing access here compared to a lot of the country. And so if you take that 25,000 or so active cases, you multiply it by 5 or by 7, that gets you to between 125,000 and 180,000 Chicagoans. And then if you just divide 2.7 million Chicagoans by 180,000, that gets you 1 in 15 Chicagoans. So unfortunately, I do not think that is an overstretch. It is somewhere between 1 in 15 and 1 in 21 Chicagoans have active COVID-19 right now, based on the best scientific estimates.
Okay, that's pretty sobering.
Yeah.
A question for you on Thanksgiving, and we keep telling people to do the right thing and to cancel their plans and just be with their own households, but everyone wants to justify things and rationalize things. So as we go into the conversation again of Thanksgiving travel, a lot of folks will tell you, you know what, I haven't seen my parents for nearly a year. They don't see anybody. I don't see anybody. What's wrong with me traveling down to Florida and spending the holiday with them?
Right. So, I do these Facebook Lives where I take questions directly from the public, and I've done more than 100 of these going back to before the stay-at-home order. And the number one question I get in every realm is like, please, can't I get an exception to whatever the recommendation is? Because it is human nature for people to think, surely you can't mean me. Surely you can't mean me when I say you have to stay home right now, or you shouldn't have somebody over, or you shouldn't have Thanksgiving. But the problem is that when everybody thinks that they are the exception, together as a society, we are not able to do this. And the fact of the matter is that I know that there are people who have been exceedingly careful, but we can't make recommendations that are different for people who have been exceedingly careful. And the problem we also find is that even people who think, I've had a very small bubble, right? Like I've only had 4 people in my bubble. The problem is those 4 people have also had the people in their bubble, and their bubble, and their bubble. And with the amount of COVID we have right now in Chicago, that 1 in 15 number, I'm not pulling that out of the sky. That is based on actual data here in Chicago. the risk is just really significant that you yourself could be bringing COVID. And then all of those states that are in red on that map, they're having worse COVID outbreaks than we are right now here in Chicago. And all of the states in orange are the equivalent of here in Chicago. You know how we were trying to keep our number under 400 cases a day? All those states in orange are having an outbreak at least that bad right now. And so our whole country is fighting with COVID. And I cannot say at an individual level, you get an exception, you get an exception, you get an exception. The ask for everybody is not to travel and to have a different and probably virtual Thanksgiving celebration. I want us to get to a point where we can all gather again. I don't want my team doing, the number of these really sad investigations that we do where people get together for birthday parties and funerals and weddings and christenings, these celebratory gatherings, more and more and more and more are significant COVID outbreaks. And I don't want that to be your Thanksgiving dinner. And I don't want that to happen across Chicago and get us to a point where more than 1 in 15 Chicagoans has COVID right now.
Right.
A couple more.
Okay. Charlie?
Yes, Doctor, I want to talk about this period between when the vaccine and the efficacy has been announced and the time it might be available. And do you have any worries that during this time people are going to say, oh, I'll just wait for the vaccine, I'm not going to do what I need to do?
Yeah, so I think a couple pieces in that. So first of all, one of the major ways that this vaccine process has been safely accelerated is that the federal government invested in a number of these vaccine candidates that showed early promise and started manufacturing while the phase 3 studies are ongoing. If the study does not show that a vaccine is effective or a vaccine is safe, all of those vaccine doses get thrown away. You've sort of wasted that money. But the ability, in a typical vaccine, you would finish this phase 3 trial, and then you would start sort of raising the money toward production. It's often a couple of years before you're really in full production. There are doses of both the Moderna and Pfizer vaccine that have already been produced, and they are in storage. And I would anticipate we may even see some preliminary distribution of that as the trial information is being submitted to FDA. It will go through all of the appropriate scientific review. I can't say that strongly enough. There will not be a recommendation at the federal level, at the state level, or certainly from me at the local level or any of our other scientific experts looking at this, unless the data on safety and efficacy looks good. But assuming that that's there, once the approval is done, the CDC has taken a look, we would anticipate to probably be able to begin very, very quickly with the healthcare workers. I am worried, and part of the reason why we started talking about vaccine today is that I think people hear, oh, vaccine is coming, I don't need to worry anymore. But the problem is that even if we're receiving potentially tens of thousands of doses even before the end of the year, which is a little sooner than I thought this might happen, it is going to be months before we have the amount of vaccine where we start being able to, talking about vaccinating hundreds of thousands or 2.7 million Chicagoans and having that available. And we didn't talk a lot of detail about the prioritization, but this will continue sort of in waves as it's available. And throughout most of 2021, even as the vaccine is being rolled out, we are going to need people to keep wearing their masks, to keep social distancing, even the people who have received the vaccine. Because, again, it's going to be hard to know who's gotten this, who has this. We want to have a general sense. And we're still learning, and will be learning, that even if this vaccine is protective to me, we still are learning, are vaccinated people completely unable to shed it to others, for example? How long does this last? There's still going to be a lot of questions. It's fantastic news. This is really, the fact that we've got a vaccine that looks like it could be more than 90% effective is huge, but a vaccine is not going to be here in the next, for most people, in the next few months. And even once it starts to be here for some time, we're going to need to continue these actions.
And if you can, once the vaccine does arrive, say it's April, June of next year, Can you give us a picture of how the distribution might look? Might it look somewhat like the testing lines now? Where would people be going? How would they be accounted for? Do you have to register with the city to get the vaccine? And will there be perhaps an app that shows, I got it, I can get into this building, I don't have it, I can't go, that kind of thing?
Yeah, so these are exactly what some of these conversations are looking like. What I can say at this point, of course, is we're planning for sort of all different timelines and all different volumes in terms of vaccine. The prioritization information that Dr. Robinson referenced does have some more detail in there about what these prioritization levels would look like. And just to give you a sense, people who are older with, serious underlying conditions would be prioritized, some of the essential workers. Children will be later because there will be trials that are done specifically for children that are not done at this point, and children by and large have not had commonly the serious outcomes from COVID-19. So we know that they will actually be in a later phase, and there will be some additional phasing. But we already have built the tech and have practiced this tech, for example, with our flu vaccine clinics, to make sure people are able to register, that we're not using paper, that this is in an app and it's being kept track of. And the city of Chicago, just like now, we're doing a relatively small portion of the COVID testing. Similarly for vaccine, probably early on, we will be playing more of a significant role in this, but as more and more COVID vaccine is available, it will go out to your traditional vaccinating partners, your family doctor, your pediatrician, your pharmacist, and we'll be working to get this out sort of across the whole system. So I am not anticipating these same sorts of issues as we're having right now with the testing. I am hopeful there will be very high demand for this vaccine, and we'll have to have really clear messaging about when it is available, sort of for which groups, and the details of what that's going to look like. We have a lot of planning that we've already done, but we will need to get some more details about timing and type of vaccine. But yes, this will be electronic. It will all be kept, securely in a way that protects patient privacy, but will be available so that we know, because it's not just about have I had the vaccine, it's which vaccine have I had. You might need 2 doses. There may need to be follow-up down the line. So this is a big tech piece as well. But we're already done with it. We used it for flu. It's working well, and it feeds in as it needs to the state and federal systems.
Thank you, Doctor.
Okay.